everyone. It's Kathleen Rose, Superintendent President at Gavilan College, and this is the Presidential Podcast. Well, welcome to our podcast. Today is April 26th when I'm recording, a month to go until the spring 2021 semester ends. I'm going to continue to focus today on student teaching, learning, and students, as I have been doing all semester long in my podcast. And you've selected an especially great day to listen in, because today we're going to focus on our allied health programs, certainly an important area of study during the pandemic, as we have watched our first responders and health professionals demonstrate great courage and resiliency combating the pandemic for more than a year. We are very proud of our allied health programs at Gavilan that has provided comprehensive clinical and theoretical training for the communities we serve for many, many decades. So if you didn't know, the programs we offer at Gavilan include a nurse assistant certificate of proficiency, home health aide certificate of proficiency, licensed vocational nursing, associate of science, certificate of achievement, registered nursing, associate of science and certificate of achievement, and public health science, associate of science. These programs have been the mainstay of our allied health program at Gavilan for many, many years. Just over the last 2 years, we've awarded 35 associate degrees in 2018-19 and 37 certificates. And just last year in 1920, that was increased. We awarded 36 certificates and, let me restate that. We awarded 36 associate degrees and 86 certificates, a huge jump in our awards for that year. I had to double check and make sure those numbers were correct myself. So definitely a source of pride for us. And we're happy today to have some opportunity to talk not only to Susan Turner, who has had more than 20 years of teaching service with the college. And we're also going to speak with 4 students from our allied health program. And they're going to share with you a little bit their story about why the Gavilan program, what their experience has been in the field during the pandemic, and what advice they may have for students who want to enter nursing. After the interview, of course, I will be back with a final section, my usual closing section, which is what's on my mind. So stay tuned, folks, and thank you so much for tuning in to the Presidential Podcast. Okay, hi everyone, it's Kathleen Rose again, Superintendent President, Gavilan College, and we are back at the Presidential Podcast. And I am so fortunate today to be joined by Susan Turner, who's been with our allied health program for more than 2 decades, and 4 current students, not 1, not 2, not 3, 4 in CNA, LVN, 1 person, Oshiel, we just took her out from her shift at Hazel Hawkins to talk to us today. And so we're really appreciative that we have so many students. So thank you so much for taking the time out to talk with us today. And Susan, hello to you.
Hello, glad to be here.
So Susan, we're going to start with you. So you have, you started at Gavilan, then you left, and then you came back, and now you've stayed. So tell me a little bit about your career trajectory and how it's been for you in your last 20 years at the college.
Well, I was a nurse for many years, and I saw students at the hospital I was a supervisor at, and I enjoyed the students and was asked if I'd like to come teach. And so in the late 80s and early 90s, I taught at Gavilan, and I moved for 10 years and then came back, and I'm back at Gavilan and have been there since 2004. So I've been there a long time. With the CNA program, the LVN program, the RN program, it's really made, there have been a lot of changes over the years, and there's more changes to come to meet the needs of the community. When you walk around the hospitals in Hollister, in Gilroy, St. Louis and Gilroy, and even in San Jose, they're full of our graduates.
Yes, that's certainly what I hear from the community members. They said, oh, I was treated by a Gavilan grad, and oh, I
Right.
talked with a Gavilan student about their experience. I love when I hear those stories. So tell me what kind of nursing you did when you were fully in practice.
I did ICU, med surge, and emergency room, and a fairly
Wow.
typical kind of career. And the nice thing about nursing is you get tired of one. I got tired of ICU because I had so many patients on ventilators. I never had a patient to talk to. So then I went to emergency room. I was at med surge and oncology for many years. I liked every single thing I've done. And the nice thing
Mhm.
I'm teaching, I get to still go to the hospital. And so I also get to teach. So it's been great.
Yeah, that's great. So what are you noticing right now about nurses who are serving during the pandemic? What are the greatest challenges that they're facing?
Well, it's so been very stressful. And I think the stress has let up as people have gotten to science has gotten to understand the disease better, and the PPE is available and there's plenty of it again. There'll probably be a glut later.
Yeah.
But it was very stressful and people worrying about what they were bringing home. Now that there's vaccines, um, if everyone would go get theirs, that would be awesome and to help cut down the numbers. But I think the stress is down. Numbers of cases in the hospital are finally down, and the number of people getting vaccinated is up. So that's
Mhm.
really helped. But it has been very stressful, and it's also very difficult, tiring working wearing a mask all the time.
Mhm.
I mean, I didn't like it when we just did it in isolation rooms. Wearing one all the time is
Yeah.
awful.
Yes, I
And
can
they're telling
imagine.
us it may be the wave of the future that we may be doing it year round with all patients. Gosh, I find that sad, but who knows?
Yeah, I've wondered about that. And we'll come back to what your thoughts are as now we're getting to the point where vaccinations and testing is so prevalent and available to us, and what you think the future of healthcare will be as a result. So, Susan, I'm really glad you're here today. And I know you have such great history with Gavilan College, and you've stayed with Gavilan College when you could have gone anywhere and taught at any major university hospital across the country. And I
I
know
like
that
it
you stay
here.
with us because of our students. You want to talk a little bit about that?
I like the smallness of Gavilan. And when I first returned, I was in Florida for 10 years. When I first returned, I taught at Evergreen. And I was happy there, but I really liked the smaller program and getting to know every single student in the class. And I
Yeah.
remember even there, I would have a student come and visit me in my office, and I'd think, was she in the class? There were so many people. We
Yeah.
had 60 in our class, and I like the fact that we have 22. That's
Mhm.
awesome. I
Mhm.
get to know everybody right away. And I like that. I like the personal part of it.
Well, and I think that it has added to the success rate of our students in our program because we have consistently had high test scores at Gavilan. In fact, we're well known for that. And I think much of that has to do with the personalized
Yeah, there's a
instruction
lot of, I
that,
think a lot more individual attention. We put a lot into the success programs. We have free tutoring for all the LVN and RN students, free of charge, 2 and 3 days a week. That's awesome. Those are things
yeah,
that help students that really made the program, increase the success rate.
absolutely. All right, well, students, here we go. This is going to be your opportunity to talk to me for a little bit, for Susan to listen, and then we'll ask some questions at the end. So, Misty, I'm going to start with you. Tell me a little bit about yourself and your background and why you chose Gavilan for your educational journey.
Hello. Well, a little bit about me. I am in the medical field. I've started in the early 2000s. I was grandfathered in um, to medical assisting for a pediatric group in Salinas. So from there, um, I have a younger sister who brought me out here to Gilroy, and I was taking care of her grandmother during the time she was diagnosed with lung cancer. Um, I left work full time to go to school full time, and Gilroy was a local um, place with a college, Gavilan. I chose Gavilan, and um, it took me a long time. I am a high school dropout, so there's been 20 plus years where I hadn't stepped on a school campus. So it was really challenging because I had to meet a lot of requirements to become a student at Gavilan. Many times I wanted to give up, but I challenged myself. And there was a lot of programs, like Susan said, that Gavilan offers. And I was just seeking out the help. And program there is AEC, Accessible Education Center. I learned that I do have some learning disabilities. I wasn't just making this stuff up. They helped me with testing. They helped me overcome a lot of my fears with testing, with the challenges that I have with learning. I am one of the rare where I need hands-on. There's multiple ways of learning. Um, I thought there was something wrong with me where I just wasn't understanding a lot of things, and it just comes to find out that I just have a different way of learning. And this program helped me a lot.
It sounds like Gavilan's services gave you the boost you needed to succeed.
Yes. They helped me reach with a lot of guidance classes to get to the college level. I didn't want to give up on myself, and I wanted to keep going and work in this medical field and be licensed and certified. And my goal is to become a registered nurse. So with the help of these programs, I am here today and made it this far.
So thanks so much, Misty, for that information and for sharing your journey with us. Oshiel, I'm going to go to you next because our listeners cannot see you on the screen, but you're out in front of Hazel Hawkins Hospital right now, and you are on your lunch break. And so I really appreciate that you've stepped out during your lunch break to talk with us today. Tell me a little bit about your Gavilan journey.
Okay, I graduated high school in 2010. I started at Gavilan College in 2011, and it took me a while to decide what I wanted to do. And I finally decided I would give nursing a try. So I started with the CNA class, and I fell in love with patient care. Then in 2016, I got accepted into the LVN program. Unfortunately, I didn't get the hang of things. I didn't pass that course. I was put on a wait list, and then I came back in 2018. And thankfully, I knew more or less what was expected, so I successfully passed that course. And then I applied to the RN program last spring when we graduated. And here I am today, about to finish.
Yay!
Very excited. Gavilan has a lot of resources for us. We have tutoring, we have Ian and Jen Wilkins, who are amazing, and then Susan steps in to lecture. She's, if we need something, we just text, email her, and she's there.
Mm-hmm.
There's really not much of a struggle to get help. I just personally in 2016 did not know what I was doing, but once I got the hang of it, it was much better. I started working as an LVN as soon as I graduated. I'm currently working in pediatric home health, and I'm planning on staying there or moving on to a hospital once I graduate.
Fantastic. That's a fantastic story. I think there's no shame in talking about starting, stopping, and starting again. It took me 10 years to get my doctorate, so someday I'll tell you that story. But I think it's really important that you recognize that there was something that you had inside that indicated that this was the path for you and that you came back and showed resiliency and persistence so that you could achieve your goals. So what would you tell other students who are thinking about coming into the nursing program about not giving up?
Well, I would definitely tell them that it's not like all the classes you've taken before. It takes a lot of time, a lot of homework time and study time. Other classes you can study the night before and you'll be fine on your test. This is not what nursing is. You have to study with weeks in advance, make some friends, and support each other. You have to have that support circle. If you're a shy person, you kind of need to get out of your bubble, because you definitely need to make some friends. If some people are better note takers than you are, and then you might be help to somebody else. Get out of your bubble, don't be shy, and know that there's resources for you out there.
Yeah, thanks so much for that. How are things different for you now doing the work you're doing in the midst of a pandemic?
It's very different as a student. We have to wear our N95s, our goggles. Patient care it was a little scary at first, not gonna lie. Your fear of, oh my gosh, am I gonna get COVID? Am I gonna take this home? But like I said, we were able to talk to our instructors openly, and they guided us into just how much more careful we have to be when we're in the patient's room. Keeping your standard precautions plus a little more is definitely important.
Absolutely, absolutely. And so one more question for you before I let you go and I go on to Rupert and Marissa. What do you do to take care of yourself in your off time?
I love to get pedicures. I love the hot stones on my legs and the leg massages, because after clinicals, my legs are just they're swollen. So I love to get pedicures. And then my daughter recently has started to like them too. So now we both get to go.
That's good. Good mother-daughter time. Well,
Definitely.
Oshiel, I'll let you get back and have at least a little bit of a lunch break before you go back on the floor. But thank you so much for taking the time and talking with us. And congratulations as you graduate this year with your RN and go on to the next chapter of your career.
Thank you so much for having me.
Certainly. And now, Marissa, I'm going to go on to you. Marissa, you gave us a little bit of information about you. Not only are you a CNA student, but you're a mom of 3, and you have some interesting reasons why you decided to come into nursing. What can you share with us about that?
Hi, thanks for having me. So a few years ago, my son, he was diagnosed with autoimmune disease. It's chronic. So I kept going to the hospitals. I got close with his nurses. I got close with his surgeons, and that really inspired me to take up nursing. When I first started at Gavilan, I just did business. I didn't know what I wanted to do. I was okay. I could do anything with a business background. But when my son got sick and I started having to care for him at home, that's what really made me want to become a nurse. And I felt the passion. I bonded with the nurses. I talked with them at the hospital. They showed me things and how to care for my son. So that's when I just did a change. I talked with my counselor and said, hey, I want to go for RN. This is what I want to do. And they supported me. They helped me. And I signed up for the CNA program, which I'm currently in. And I love it. It's like the best decision I made.
That's great. And how is your son doing?
He's good. We're managing it now. He's good. Yeah.
Good. So what has been the most surprising thing to you about going back to school and going through the CNA program?
Well, I started back at Gab last year. So it's my second year during the pandemic. So it's like right when it happened, I'm still going. So I'm taking the CNA, plus I'm going for my degree in health science. So it was difficult. It was hard. But I just kept going. I have little ones. My youngest is 2. But this is what I want. This is my dream job. This is my dream career. So through all the struggles, I guess I would just say I just keep pushing myself and reminding myself. And honestly, like when I go into class, right now, because of the pandemic, it's once a week in person. I just fall in love with it even more. And it just reminds me like, okay, this is what I want to do.
Yeah, that's great. When we started allowing some classes to come back on campus, the nursing program and our CNA and LVN programs were the first to be able to come back. And I know that you have all learned about all the usage of PPE and how to use our QR codes and how to access campus and so forth. And I really appreciate that you've all added that additional logistical duty to what you're doing as you're studying. So thanks for hanging in there, Marissa.
Thank you.
And now, Rupert, I don't have any notes about you, so you are a blank slate to me. Tell me a little bit about your Gavilan journey.
So I'm a first semester LVN student, and this is my first semester here at Gav. So it's all new to me. I'm from the Central Valley, so I'm not even really familiar with the area, well, up until now. So I got a bachelor's in kinesiology, and nursing has always been in the back of my mind, but it wasn't extremely my first choice. You know, I come from a family of nurses, and they all like pushed it onto me at a young age. So just like any other teenager, your parents tell you what to do, you want to do the exact opposite.
Yes.
So I went to school, and I kind of just was open to anything. I worked in mental health for a little bit, and we got to work next to some LVNs. And that's where I kind of got to see exactly what they do and how they do it. And they're just really professional with the patients. So I applied all over the valley at Gav, and I got accepted at Gav. So I just took the opportunity, and I'm glad I did because I really like the school and the instructors. And we just started our clinical rotation at Hazel.
Mhm.
And it's just like a whole new world. Like I really enjoy being around the patients and being able to hear all these different kinds of stories. And
That's
everybody's
great.
very welcoming.
So you said you come from a family of nurses. Tell me
Mhm.
about that.
So my mother's a nurse in the military. She's still active. All my aunties and a lot of my cousins are nurses.
Mhm.
And so growing up, it was the end all be all job. You know, it's very practical. It's well paying. You can go anywhere in the country, maybe even the world, and have a job. So that
Mhm.
was all appealing. But out of high school, I did the CNA class, and I'll be honest, I felt like it was just not for me. I got cold
Mhm.
feet about it. And then going through school at Stan State and seeing all the nursing students and how they are and all the instructors, it kind of just sat in the back of my mind for a long time. And then it just became my plan after that.
Mhm. So you've had the opportunity to observe nursing for a long time, and we're really happy to have you in the Gavilan program. What do you think you'll do? Where do you think your path will take you?
My end goal is an RN and then the BSN. And
Mhm.
as far as departments go, I got to do 1 day in the ER at Hazel. And that was really cool. I can see myself working in a fast-paced environment like that.
Mhm.
I really enjoyed it.
Yeah, great. Now, what do you like to do in your spare time when you're not studying?
I like to get on my bike and put a couple miles in. I have an old
Mhm.
Giant from the 90s that my dad gave me, so I just try and put some miles in when I can.
Very good. Do
Need
you
to
think
burn out
it's
the fat.
important to keep a balance between kind of the high stress work that you do as an LVN and your life in general?
Oh, absolutely. I think stress management is really important, especially for burnout. And
Yeah,
even
yeah,
if you're already working, you got to take that time for yourself.
yeah, absolutely. All right. Well, thanks, Rupert, for that. We'll come back to you. Misty, I didn't ask you that question. You have a pretty busy life too. What do you do to keep yourself balanced and healthy in the midst of a really difficult and challenging career?
I do believe you have to find the time for self-care. Um, Getting outdoors for me is something I like to do. I call it therapy, walk on the beach or take a hike. I do
Mhm.
like to roller skate. So that's my cardio. I put my skates on and find a trail. But it is very important to find time for yourself. Yes.
Yeah, absolutely. You know, another question I've been thinking about, because we've been reading now, nurses and certified nurse assistants, LVNs have been at the forefront of our news feed just about every day. What do you think the world doesn't understand about the work you do, especially during the global pandemic? What do we need to understand about the work of nurses to provide better support for what you do? Rupert, we'll start with you.
I think just understanding that nurses have families and other difficulties in their life. And, they're not robots, they're humans, so they make mistakes. Not often, but it does happen. And burnout is a real thing. And I think with COVID, there's a lot of pressure, especially on nurses, to kind of show up and be there for long hours and a lot of shifts.
Mhm.
But I think it's important to the public to know that they're human.
Yeah, absolutely. I agree with that. Marissa, what do you think about that? What does the world need to know about the challenges and the stressors of the nursing profession?
I agree with Rupert. We're all human. We're all caring. We all have our own struggles and difficulties, and we're trying to manage it all. And to take that in consideration, because I know right now with everything going on in the world, it's very high stress. And, a lot of people are lashing out at people in the healthcare. So I would say just remember we're human. We all go through challenges, and it's very stressful right now. Even in school, a lot of people are like, why are you doing your CNA program during the middle of the pandemic? Is that smart? I'm like, yes, I want to help. I want to continue. I want to be there. I want to, Gavilan College, even did volunteer work giving out COVID shots. I want to be part of this. I want to help.
Mhm.
Even though, we're all going through the struggles, we just got to keep going. And yeah, I agree with Rupert. We're all human.
Yeah, I appreciate that. So Susan, in our curriculum, I'm sure that you provide a lot of focus and emphasis on self-care as well as care within the profession. How have you seen that change over the years?
I see the students over the years are have more stress than ever because our area has gotten so expensive that many of our students need to work, which makes it even more difficult struggle to stay in school
Mhm.
because the programs are huge. They're full time. And the LVN program does about 30 hours a week of class and clinical. And that's before you've opened your book. The
Mhm.
RN program is about 25 hours a week before you've even opened a book. And then if you have to work to keep the roof over your head or your family's head, there's only so many hours in a day. So I think the students struggle. And then you add the pandemic and their kids are being at home and having to homeschool. I mean, it really is overwhelming because
Yes.
nursing school is overwhelming every day because it's not like taking a history class where you
Mhm.
have your 3 hours in your little box and you read your readings. It's you're dealing with people's lives and you have to be very careful and not make mistakes. There's a lot to it. There's a lot of moving parts. And then you add the stress of you don't want to just be a nurse, you want to be a good nurse.
Mhm.
You want to be an
Mhm.
excellent nurse, so you want to do it right, but you've also got all these competing high priority things like your family, your health, getting gas in your car. It's a
Right.
lot, and I think the students' level of stress because of how expensive our area is makes it even more difficult.
I totally agree. So students, despite all of that, despite the stressors and the multiple priorities and tugs on your time and everything you have to do with studying and clinical, it sounds like you are very devoted to your field and you're really looking forward to what the future brings. What advice would you give to future students as they consider a taking up nursing school or coming back into a program like Gavilan? What do you think they should think about? Marissa, I'll start with you.
So like I was told when I was thinking about nursing, go with the CNA, start a CNA program, see if this was for you, and which I did. Um, and that's kind of where I kind of like really found myself, okay, what I like to do. At first I wasn't sure, but now I really like patient care. I like, caring for people. So I would suggest start with the CNA class, see if this is what you want to do because it's a long career. I mean, you're gonna be in school for a while. It's hard. It's not an easy choice, but it's all worth it. And continue
Mhm.
and don't give up. And there's some days that are hard, and especially because we're in a pandemic, and who knows, if this is gonna be the new norm for a lot of stuff. But it's gonna be worth it in the end. Just keep going.
Yeah, that's great advice. Thank you. Misty, what do you think? What should future students know?
I think future students should know not to be discouraged by anybody else's stories. I know when I said I wanted to go back and back to school and do the RN, a lot of people told me it was hard. A lot of people told me they failed the first time. I like to keep going. If I fall, I rise back up. Know that there's a lot of resources out there for you to reach out to. And at Gavilan, there's plenty of good programs there. Just don't give up on yourself and continue.
That's great advice. And Rupert, how about you?
I think if I was to go back 5 years to where I would give myself the advice of when you're taking the prereqs, take them very seriously because it's the door, it's how you open your doors to these programs like this. So it's really important that you get good grades in those prerequisites. And I would agree that you might not get in the first time or the second time, but just keep applying. If it's really what you want to do, then you have to keep applying. And
Mhm.
once you're in, you got to it's really like, and not like any other classes that you'll take. You really have to study and study hard.
Yeah, there's no sugarcoating it for sure. It sounds like once you're in, you have to make sure and commit to the discipline. So students, I want to thank you for being a part of the Presidential Podcast today. I know that I'm taking time out of your study time for you to come and talk with me today and let other students know what your thoughts are about the allied health programs at Gavilan. Truly, the allied health programs are one of the crown jewels in the programs that we offer. We're exceedingly proud of this program and exceedingly proud of our graduates every year. And so, Susan, as we close out, what do you think the future holds for nursing as we start to emerge from the pandemic? Vaccines, testing, we're starting to think about coming back with more sections at our campus in the fall. What do you think the future holds for the nursing profession?
For the nursing profession, I think there's going to be more jobs than ever coming up. There's a large population of baby boomers, of which I'm in there, that it's a large percentage of the nursing population are going to be retiring in the next 5 years. And the 22 that we admit in the RN program and the 25 we admit in the LVN program may not be enough to meet the future needs, because they're expecting, it to really ramp up. And I think the pandemic, for those who are thinking about retiring, I think a lot of them have thought, sounds like a good idea.
Yeah.
And so there are people exiting the workforce, and we need to get people into the workforce. And one of the things that has been our strengths is that our employers that hire our students continue to say, as we make students that are ready to go, when they finish our LVN program, they finish our RN program, they are skill ready to go. And that's not the case with all nursing programs, but it is the case at Gavilan. And the students report themselves when we do surveys later. How prepared were you compared to other new graduates that you started with? And they overwhelmingly say, way better prepared. And that's really the strength of our program, is we make excellent bedside nurses that are ready to start in the hospitals.
Boy, that's a great testimony to the strength of our program and the strength of our teaching. And Susan, I know you're at the core of that. I want to thank you very much for taking some time to be with us today.
My pleasure.
And before we go, students, is there anybody you'd like to give a shout out to? Thanks to family or faculty or anyone you'd like to say hello to before we close out this segment of the podcast?
I think just the entire LVN instructors, the Maggie and Mary Helen and all of them, I think they're really doing a good job.
Okay, that's great.
For Miss Diane Reed, my current instructor for Allied 280, doing a great job.
Good deal.
Yes, and my Diane Reed too. She's my instructor, and just our whole CNA class. I want to say we're almost there.
You are almost there. Absolutely. Well, students and Susan, thank you so much for coming on the Presidential Podcast. I appreciate your comments today and good luck as you finish out the semester. Hi, everyone, and welcome back. That was really great to be able to talk to 4 students in our Allied Health program and to Susan Turner about their experience becoming a part of a profession that we have all depended on greatly, even more so over the last year of the pandemic. So this is the last segment of the podcast that I try to record every time I have a chance to talk with you, and that's what's on my mind. So this week, I'd like to talk a little bit about our theme where we started at the beginning of the year. That theme was the idea of equity, inclusion, and healing. And I don't think any of us knew at the beginning of the year that we would still be in a remote situation, still having the kinds of conversations we're having around equity and inclusion. You know, we're learning how to have courageous conversations across campus, in webinars, in our governance committees, in forums, and certainly in the classroom. And we're learning to get comfortable with the idea of talking about racism, social justice, equity, privilege, intersectionality, and power. And we also know that going forward, as we heal from the pandemic, that we must stay engaged in dialogue with each other, even when we experience discomfort. We need to have environments at Gavilan where we can speak our truth and also expect and accept non-closure. In other words, there are many more conversations to have ahead. And I think that's what our theme of the year, equity, inclusion, and healing, was really all about. All stakeholders at Gavilan are showing up and staying present for these important conversations, from the faculty to the staff to the students, and certainly the Board of Trustees. We appreciate having the environment to share at Gavilan that values many voices. You know, after all, there have been many, many voices before us to contribute to this work. There's 2 quotes I'd like to share with you around that. And the first is from Maya Angelou. And the quote is, "Prejudice is a burden that confuses the past, threatens the future, and renders the present inaccessible." I think there is so much truth in that statement. And then also one from John Lewis, who, as you know, was an American politician, civil rights leader, and who served in the House of Representatives from 1987 until his death in 2020. And John Lewis said, "Ours is not the struggle of one day, 1 week, or 1 year. Ours is not the struggle of one judicial appointment or one presidential term. Ours is the struggle of a lifetime, or maybe even many lifetimes, and each one of us in every generation must do our part." So as we conclude this semester, we are looking forward to our virtual graduation ceremony, which will be happening at the end of May. Our drive-through diploma pickup will be occurring this summer, and we have staff returning to campus this summer to prepare for welcoming back students for an increased number of sections in the fall. We will continue to provide wraparound services for our students. We've learned a lot about that, and we've listened to you. So we will continue to offer those services both academically and personally to help you to achieve your goal while at Gavilan College. Please check out our Gavilan College website to learn more or to sign up for services that you need. So the pandemic has strengthened our skills in serving students and caring for one another. And even though we are not together every day on campus, I feel that, and I hope you do too. We will face our healing time together with an idea of engaged humility, and will continuously demonstrate our willingness to grapple with the challenging issues, understand the difference between opinion and informed knowledge, and focus on the practice of equity in all that we do. I look forward to sharing more about this with you in the podcast to come. And so for now, thank you so much for listening today to the Presidential Podcast. And I look forward to welcoming you back on campus very, very soon. Take care.